I usually get my mammograms, if not every year. I usually don't let more than 16 to 18 months go by. And since I've started getting mammograms, that's come back. I've maybe gotten 3 of those letters saying for me to come back for a secondary. So when I came in for that secondary, I thought it was just routine until I was actually here. And they said, no, we think we've seen something. And they told me that I would know something one way or the other before I left that day. And when my technician came back in and said, yeah, the doctor wants to talk to you, I knew that it wasn't normal. And so that's when I was able to speak to a doctor over a video conference.
I am worried about what we saw on your mammogram, and we were able to find an area on ultrasound that corresponds. So if you want to look here at your images, there's this.
One of the essences of breast imaging is providing care. You know, establishing rapport with patients, letting patients know that you're there to guide them and take them through a journey that hopefully is nothing, but could potentially be one of the most difficult journeys that they have to take in their life. And we want to be there to hold their hand through that. And is there a way to figure out how to do that in a virtual sense? And that's what we came up with. And what we've leveraged is a very sophisticated teleconferencing solution, which is a dedicated platform that lets us communicate directly with those patients, give them their results, establish that face-to-face patient interaction that we all value in breast imaging wherever they are. The other great part of the technology in terms of what it lets us do is it lets us share imaging with patients so that they can actually see what we're talking about. It makes more sense to them. You can really kind of get that understanding across to those patients.
Well, here at Memorial Medical Center, we pride ourselves on treating every patient with dignity and respect in a very compassionate, loyal manner and a cost-effective manner. And so I can say having this virtual mammography technology available in our community is really a godsend. It is one of a kind, and we're very excited about having it. For a patient to be able to have that real-time service and not have to leave the facility with a lot of unknowns, a lot of questions they can't have answered, I must say to our community that we are very fortunate to be able to have this type of service, and we should not take it lightly. We should tell the story so that others who are not experiencing this type of patient experience, that they will come to Memorial Medical Center knowing that they will have a virtual radiologist who will be able to share and talk to them about the recent diagnosis.
I feel like for once the patient actually has somebody that they feel like they rely on. Somebody that is specialized in this area that can lead them to, this is going to be your next step. I mean, we're giving you some of the best rads to read your mammo at a facility that you call home. I mean, I think that's the best you can get.
You have to make sure that patients get taken care of regardless of where they're going for their care. What we consider bread and butter imaging in a metropolitan area like Dallas or Houston or New York, that's not bread and butter imaging in their communities. So something needs to get fixed. How do we reach that patient population that's sitting there that needs to get taken care of? How do we reach everyone across the country? It's just a matter of leveraging the technology that we know exists.
Having Memorial Medical Center here in Port Lavaca is great. I mean, my mother received care here for many years, off and on, before she passed away. And it was a comfort to me knowing that I could also come here and see those same nurses, same technicians that have taken care of her for so many years, and video conference with the radiologists that I had. For people here in Port Lavaca to have that access to that kind of care without having to travel to a big city, you know, I think that's very important.